Welcome to BFR Tuesday. I'm Cara. I host this every week in order to answer any questions regarding blood flow restriction training. Last week, I answered the question I've been getting a lot around positive COVID-19 diagnoses and what to kind of do to manage that. So if you missed that one, go back and listen to that about recommendations from a training standpoint after diagnosis of COVID-19. I always start these sessions off with a question and answer. So if you go up to the chat section on your upper right and you just type in a question, I'm just going to pin in hello from Dallas, Texas. And you can type your question in there and I'd be happy to answer. I'll give it about a minute or so. And if I don't get any questions, then I can chat about anything else that's relevant right now. All right, doesn't look like there's any questions. So I think probably, let me think patient-wise this week if there was anything super interesting around the training. Not really, it's been kind of a quiet week this week. Let's see if there's anything interesting, because I'm currently writing this book, and so questions always come up around what do I want to answer in the book from a training standpoint. We could talk briefly about recovery, like what constitutes a recovery session after training using BFR. And if you look in the literature from a recovery standpoint, what I typically will use is in the lower extremity, 60 to 80% limb occlusion pressure, upper extremity, 40 to 50% limb occlusion pressure, and then doing somewhere between 3 to 5 rounds of 5-minute on pressure, 3-minute off pressure. So you I'll write it out in the little blog. So for recovery, we do 60 to 80% LOP lower extremity, 40 to 50% LOP upper extremity. And we're going to do 3 to 5 rounds of 5 minutes inflated and 3 minutes deflated. So they just sit, and if you're on the legs, you're just going to inflate the cuffs, hold that pressure for 5 minutes, and then deflate for 3 minutes. Repeat that between 3 and 5 times for your recovery post-exercise. And what the thinking is really the cellular swelling component. You're blocking blood flow to come back to the heart. So you're accumulating flow in the extremity, which is going to put a pressure outside of the cell. And then what that's going to do is force fluid into the cell. And that fluid in the cell causes the cell to expand, called cellular swelling. That cellular swelling then stimulates the brain into thinking that, ooh, there's going to be some damage here because these cells are going to explode. So the body and the brain respond by doing things to try to repair those cells that are going to or basically break, and you get the healing components because of that. So that is your recovery type BFR. You can use that after every training session. And it just takes a little bit of time, 46 minutes, basically, if you're to do 5 rounds, it's on, 3 minutes off. So it's a long protocol. In my clinic, I just send them to the back where we have a recovery room, and they can just hang out, and I let them put their timer on, have them inflate, and then deflate. The nice thing now about the new cuffs is that the pump automatically will resume from its previous pressure. So it's super easy. On our next version, what I'm hoping is to have all these protocols built into the technology, so you can just hit, recovery, and it automatically does it for you, finds the LOP that's recommended, and inflates it to the certain percentage of that LOP. And then after 3 minutes, it deflates and then reinflates. It sounds like that should be a no-brainer, but from a programming standpoint, it was a little bit difficult for us to get into this version with everything else that happened with this new version. It was just too much. So we'll put that probably in Gen 4, which I don't know when that'll be. It'll hopefully 2022 is what I'm guessing, but we still have some work to do to finish up and get caught up in the current version. So don't want to think outside what we're thinking, but we're always anticipating what the next generation is going to look like. All right, so that's recovery. Hope that helps anybody that's interested in recovery for their athletes and their patients. If you have any questions for me, send me an email, ed@edlacara.com. Otherwise, I will see you next week. Thank you so much.